Now, back in September, Discovery Health introduced mandatory vaccines for its employees. It said this was aligned with the company's core purpose to enhance and protect people's lives. Let's get an update now, and let's talk to Dr. Ronald Whelan from Discovery Health. Dr. Whelan, good afternoon. An overriding question first. Since September, how has your mandatory vaccination policy been going?
Well, good afternoon to you, Dan, and good afternoon to your viewers. We are delighted with the progress on our mandatory vaccination campaign. As of today, we are 94.4% of Discovery staff members vaccinated. We're very proud of this achievement. You'll recall when we launched this program back in September, we had 2,100 staff vaccinated at that point. We're up to just short of 10,000 staff members vaccinated as of today. So it's been extremely successful, and we're very proud of our staff for this. They really have stood up to the challenge and the occasion. When we started the program, I said to our staff, I knew that they were leaders in their families and their communities, and I was confident they would rise up, and they've certainly done that.
And these staff members, these employees, are in your head office you're talking about, or across the different parts of the country where you have a presence?
So it's across the entire country, Dan. It's a mandatory vaccination program for all of our South Africa-based employees. It includes our 4 main offices across South Africa, together with our franchise offices that you would see in your local community. So it's an extensive initiative. It cuts across over 10,500 staff members.
So the total staff complement is 10,500. Those that are all over South Africa, they are based in South Africa. And you said you've achieved how many now? By how many have now vaccinated?
So we're just short of 10,000. So we're 9,900 odd people vaccinated at this stage. So that's 94.4% of our staff. We are working through a process at the moment where there are some staff who have objected to be vaccinated. We have a formal process to allow staff to object to be vaccinated. We're working alongside those staff members in a very thoughtful and rigorous process, looking at those objections, understanding those objections. We're getting,
So it's pretty good going at 94% of your total staff complement the space in South Africa. So those who are objecting, who say no, you say you are dealing with them with a particular process. Can you just share with our viewers what kind of process would that be for that member of staff member of Discovery who says no jab for me?
Yeah, I mean, I think we're going to fight until the bitter end. We certainly don't want to leave anyone out on the field in terms of vaccination. So we have done extensive work around communication, marketing, incentives, one-on-one consultations with staff up until this point. We will now move into the objections review process. The objections review process is a mutual engagement process alongside our staff members that would look at the different cases, engage staff members to understand those objections. As I said, we will seek external input and advice where we need external input and advice, whether those are from medical experts or religious scholar experts in evaluating those. And we're certainly going to work throughout the course of the next few weeks to understand those objections and see whether there's any chance we can, perhaps, present the right facts and figures that would motivate additional people to get vaccinated.
If they still, after those consultation processes, whether religious or otherwise, still are convinced that they don't want the jab, what would Discovery then do?
Well, I think it's important to point out, coming out of this objection process, there will be a number of objections that would be reasonable and justifiable objections, and we certainly are open-minded to that. If the objections received are reasonable and justifiable, we'll move to accommodating those employees in some shape or form. There are a number of reasonable accommodations we could consider in that regard. And then, for those cases where we unfortunately can't achieve mutual ground, we will move into a disciplinary process of sorts, recognizing that the actions would then be counted to our internal policy in relation to vaccination. But as I said to Dan, I'm very, very hopeful that we're going to have hardly any, if any, people in that disciplinary process. As I said, our employees have all stood up to the challenge here. They've risen to the challenge. We're very proud of what's been achieved, and we're going to work hard over the next few weeks to try and get everyone, the remainder of our staff over the finish line.
Yeah, one would understand your position when it comes to face-to-face interaction, like either at some of your centres where there's direct customer service. But there might be some of your employees, those who are under that objection category at this stage, that 6% that you're still dealing with of your staff complement, who can do their work and perform quite well away from other people, that they don't need interaction. They might do stuff either via Microsoft Teams or Zoom. Will Discovery be open to something like that, where somebody will be allowed, if as you said, it's reasonable and you need their skill, but they can do it remotely? Would you allow them not to be jabbed and stay remotely?
Yeah, absolutely. As I said, if the objection is reasonable and justifiable, and that's why we're spending so much time understanding and evaluating the objections, we will certainly move to any accommodations for those. And as you rightly mentioned, it may be work from home, it may be regular testing. So that'll certainly be the case. At the same time, I think it's important to point out, Dan, that we will ensure that the process is entirely fair and rigorous, and the objections really need to be reasonable and justifiable. We can't have spurious objections where people just turn up and say, I don't feel like being vaccinated. That's not a valid reason and objection. But there are many valid reasons and objections, and we certainly seek to accommodate those.
Yeah, and just to finish off, the President announcing the other day, on Sunday, that he's setting up a task team, national task team, that will consult widely around the issue of making vaccinations mandatory in the country. We've seen some responses and reactions, including from trade unions like the Federation COSATU, saying they support mandatory vaccination, but there has to be a process. There are other people who've got question marks, and some people say we can't be forced to do it. Your lessons that you'll be willing to share in those consultations, because I would think somebody will talk to Discovery, somebody from government, from the Department of Health, because you've got an experience ahead of many other companies in the country. Since September, you've been doing this. You're sitting at a 94% coverage rate. You've done something right to make sure that your employees, even those who were not sure about it in the beginning, have now got the jab. What would be those key lessons that you would share with the country as it tries to make sense of whether or not it should adopt mandatory vaccinations for all?
Yeah, I think the first thing, Dan, is we're in a tricky position now in South Africa. As you know, we're on the cusp of a fourth wave with a potentially very concerning variant through Omicron. We've got sufficient vaccine available in the country, so it's imperative for us to move quickly now to up our vaccination rates, prevent any further effect coming out of the fourth wave. So I think the first lesson for us around this thing is we need to move at pace, and we need to move decisively. I think the debate is well timed. We can't spend too much time debating this. I think there's some learnings to take from other countries globally. We've seen Austria's implemented a policy recently. I saw earlier this afternoon, Greece has now implemented a mandatory vaccination policy for over 60s, Italy, France, and so on and so forth. So let's take the learnings from those countries. Let's act decisively and quickly in the face of the fourth wave. And then I think in true South Africa style, we should engage in vigorous debate. It's always important that we have debate and consensus of views in South Africa, but at the same time, we don't have a lot of time for that. And then I think the most important thing for us at Discovery in implementing our policy is we've taken an approach where one of our principles is mutual respect. And throughout the process, we have engaged with our employees in a mutually respectful way. We've listened hard, we've thought hard, we'll continue to do that. We've followed the data and the scientific evidence. So I think those are certainly some of the learnings we can take into a national mandatory vaccination approach.